There are now 11 confirmed cases from the Hantavirus outbreak on that cruise ship, which has killed 3 people now. And the World Health Organization says all the infected are either passengers or crew from the MV Hondas. In the meantime, at least 29 Americans who are on the ship are under monitoring across multiple U.S. states. 16 of them are in a special facility in Nebraska, including Jake Rosieren. He spoke to NBC Today about his life under quarantine. I do not have the virus. I'm well. I have no symptoms. I feel good and I'm in good spirits right now. Yesterday, I kind of was just taking the time to speak to friends and family and let them know that I was okay. Yes, you can order out. However, it might not be able to be delivered right away, but you can get things delivered, care packages, and that's nice that we have really, access to whatever we need. 2 other U.S. passengers went to a biocontainment unit at Emory University in Atlanta, and that's where our Jacqueline Howard is standing by. Jacqueline, you just got an update on the cruise passengers there. That's right, Brianna. The Department of Health and Human Services just posted on X just over an hour ago and said that one of the passengers here at Emory University Hospital who was showing mild symptoms, they have tested negative for the Andes variant of Hantavirus. Now, this is an update where they said this test was done last night, and this is one of the 2 passengers here in Atlanta. The other passenger is a close contact of that first passenger, and the other passenger has remained asymptomatic. But still, Brianna, as these passengers are being evaluated and monitored, testing is going to play a big part in this. And watching for symptoms is going to play a big part in this. Here's what infectious disease physician Dr. Aneesh Mehta said about receiving these 2 patients here in Atlanta. He spoke in a news briefing yesterday. Have a listen. The passengers that HHS asked us to receive here at Emory University in our Search Communicable Diseases unit. One was symptomatic when assessed when leaving the Canary Islands. The other one was a close contact of that individual who was not symptomatic. The care that these 2 individuals receive is the same care that we deliver to every patient at every university hospital every single day. And that is a patient and family-centered model of care. And Brianna, as those 2 passengers here in Atlanta continue to be monitored, here's a diagram of what the special isolation facility looks like here at Emory. You'll see on this diagram, Area 1 is where doctors enter the space, they put on their protective gear. Area 2 is an example of what a patient room looks like. And again, these 2 passengers here at Emory are 2 of 18 total that are being monitored here in the United States. The 16 others are in Nebraska. And in the post on X, the Department of Health and Human Services also said that the 16 passengers who arrived at in Nebraska, they are actually remaining asymptomatic. So that's another update again from the Department of Health and Human Services. But Brianna, this virus has a long incubation period. So these passengers are going to continue to be monitored for about 42 days. And we also know that when you're in a situation like this, it's likely that more cases may emerge in the days to come. So that's also something that health officials are watching closely. Brianna, yeah, and they may be expecting that. Jacqueline Howard live for us in Atlanta. Thank you. The World Health Organization now says there are 11 cases of Hantavirus linked to the cruise ship Hondias. A French woman who became sick after being evacuated is in intensive care in stable condition, we're told. Here, in the U.S., 16 passengers are quarantined in Nebraska. 1 is in the biocontainment unit after testing positive. None are displaying symptoms. 2 other people, a couple, are in a biocontainment unit in Atlanta. At least 1 is showing symptoms. Today, we're hearing from some of the passengers as they begin weeks of quarantine. They describe the terrifying moment on the ship when they were first alerted to the virus. I think it was a really scary moment for me personally. I think like anyone, when you hear a virus that you may not know about, you Google it. And probably when you Google this virus, it's some very scary statistics. However, it is a virus that we do know about, and it took me some time over those coming days to do more research and learn more about it. But it was a scary time and I had a lot of up and down emotions, but I spent most of my time in my cabin. And joining us now, our chief medical correspondent, Drive, Sanjay Gupta. Sanjay, what do the weeks ahead look like for those who are starting quarantine? Well, it's 6 weeks, so 42 days, that's sort of the and in combination with the time on the ship, the incubation period for this virus. The time period from when someone might have been exposed to the time when they might develop symptoms. I think these first 72 hours are going to be the most critical. This is sort of an assessment period for them. doing a medical exams, things like that, but also getting a sense of did they have contact with somebody who has the virus? Did they have contact with someone who was sick? Obviously, seeing if they develop symptoms. I think one of the big questions is going to be do people need to stay in the facilities there, or could they potentially go home and be monitored there? We're still sort of trying to nail down where I think the recommendation is they stay in the facilities, but they may allow some of these folks to go home as well. And then see sort of what happens. It is likely, we're hearing from just about everybody that there may be more people who subsequently test positive after developing symptoms. So, we'll see what happens. These are incredible facilities, Wolf. As you know, I'm on the faculty at Emory. Ebola patients were brought back here several years ago. They have a mechanism to try and prevent other people obviously in the facility from getting sick, but also provide care should any of these patients get sick. Wolfa officials have continued to say, Sanjay, that the risk overall is low, that the spread of the virus is usually limited to close contacts. Here's what the Assistant Secretary of Health for Health and Human Services had to say. Let me be clear. Let me be crystal clear. The risk of hantavirus to the general public remains very, very low. The Andes variant of this virus does not spread easily, and it requires prolonged close contact with someone who is already symptomatic. Even so, we have taken this situation very seriously from the very start. Sanjay, do you agree? Well, I think a lot of this it comes down to a study that was done of what is known as a super spreader event back in 2018. There's not a lot of data on this, right? So, thousands of cases maybe around the world, hundreds of cases of human-to-human transmission, not a lot of data, but let me show you this image and we can put it up on the screen and basically tell you the story of a guy number one in the middle of the screen there, who was a guy who walked into a birthday party and was there for 90 minutes. He was sick when he walked into the party. And you see the other red numbers around the tables there. 5 people who got sick as well became infected as a result of this event. 4 of those people are in close proximity, as was just said, within 40 or so. But there was another guy who was across the room, and that was not in close proximity. And the only time they had any proximity was when one was leaving the restroom and one was going to the restroom. The restroom's in the bottom left corner. So, is that considered close contact? Probably not. I think that the question becomes, if you're infectious, if you're sick, during that time, you could potentially spread it to people who are even further away for shorter duration. Wolf, Drive, Sanjay Gupta, thanks as usual. Appreciate it very, very much. Joining us now is Bryce Warner. He's a research scientist at the Vaccine and Infectious Disease Organization at the University of Saskatchewan and has extensively researched antiviruses. Bryce, thank you so much for being with us. The Andes strain is rare. By some estimates, there's only like 3,000 documented cases of it. Perhaps the most well-known outbreak was back in 2018 at the small village in southern Argentina. What did scientists learn there? Yeah, so, I mean that you're right, that was the largest outbreak that had been documented, and that was really, by far the largest person-to-person spread that we've seen. It was, over 30 cases and a high case fatality rate, and that was spread through, a person attending a birthday party. And so that was really the first sort of transmission to humans that we've seen that we think of in the typical context. Most of the previous cases of human-to-human transmission had been sort of in the hospital setting. And so this was really evidence showing that this virus can transmit human-to-human, although it is rare. So when we hear about human-to-human transmissibility requiring close and prolonged contact, perhaps not a coincidence that not far from where this boat docked there had been this outbreak, and then you have people on board an enclosed space in which they're constantly interacting with each other, and the folks that prepare the food are interacting, and so I guess my question is how do we know what that kind of close proximate contact means? Outside of a cruise ship. Yeah, and so before this happened, we would normally have thought of it as like in the context of that previous outbreak, or really in the context of someone caring for someone who is sick, like a healthcare worker or a loved one taking care of their family member or something like that. This cruise ship is, a unique situation obviously, and so where we're seeing, a married couple in the same cabin, but then people, interacting in close quarters on the ship, probably in the dining hall and things like that. And so, this is just another, mechanism that adds to our understanding of how the virus can transmit. And just so that we're clear, the virality and intransmissibility of it, how exactly is it that it jumps from person to person and in what window of time? Yeah, and so the evidence there, really indicates that the period of transmissibility is maybe a day or two before you start to show symptoms and then through that symptomatic period. And then it would really be in, bodily fluids, close contact with, saliva, any sort of secretions, things like that. So, you really do have to be in close contact with the person. It's not, through speaking and through airborne transmission like we think of with influenza or CO-19 was. And so after several days of observation, the folks that are being carefully watched, officials are going to decide whether those 15 will actually get to go home for the rest of their 42-day monitoring period or if they'll stay under medical observance. I wonder which you think is more advisable, how they go about even making that decision. Right, and that's really one of the main questions we've been getting the last couple days is which is preferred, and it's a difficult question to answer, and it's really up to each jurisdiction and what their tolerance level for this risk is. I think both ways make sense. Some jurisdictions are sending people